These are the before and after faces we've become used to seeing on celebrities and social media influencers. Thinner faces, hollow cheeks, sometimes a noticeably older appearance. It's become so common that social media has given it a name, Ozempic face. And it's part of a much bigger phenomenon that's helped turn weight loss drugs into one of the pharmaceutical industry's fastest growing markets. But there's an important question behind all those transformations. What happens when people who aren't diabetic, obese, or medically overweight start taking these drugs simply to become thinner? Ozempic first hit the market in 2017 as a treatment for type 2 diabetes. Its active ingredient, semaglutide, mimics a hormone called GLP-1. Put simply, it reduces appetite, makes you feel fuller, and slows how quickly food leaves your stomach. And people can lose significant amounts of weight. That's where things exploded. Ozempic began being prescribed off-label for weight loss. Off-label simply means doctors are prescribing a drug for something it wasn't specifically approved to treat. Ozempic became the household name, but an entire generation of drugs followed. Wegovy contains semaglutide too, but is approved specifically for chronic weight management. Then there are drugs such as Mounjaro and Zepbound, which contain tirzepatide. And suddenly, losing significant amounts of weight through a weekly injection became a cultural phenomenon. From Hollywood to social media, the transformations were everywhere. And so was the money. The global market for obesity drugs is already worth tens of billions of dollars and is widely expected to exceed $100 billion annually by the end of the decade. Novo Nordisk and Eli Lilly have become pharmaceutical giants partly on the back of demand for these drugs, and the potential market is enormous. More than 1 billion people worldwide are living with obesity, a condition linked to diabetes, cardiovascular disease, and several cancers. For those patients, GLP-1 drugs can provide significant health benefits.
GLP-1 receptor agonists have changed not just obesity medicine, but metabolic health overall. So yes, we see people lose weight, but we also see people have better heart health, better liver health, improved joints, improved self-confidence. So it's beyond obesity medicine.
But there's another side to this boom. These drugs weren't developed to help otherwise healthy people lose a few kilograms for cosmetic reasons. And researchers don't yet have the same quality of evidence showing what years of unnecessary GLP-1 use could mean for people who aren't obese or medically overweight. What we do know is that the drugs aren't harmless. Common side effects include nausea, vomiting, diarrhea, constipation, and abdominal pain. More serious complications can include pancreatitis, gallbladder disease, and kidney injury, particularly when severe vomiting or diarrhea causes dehydration. Then there's what happens to the weight itself. Rapid weight loss doesn't only remove fat. People can also lose lean mass, including muscle. And concerns about bone health are still being studied, with recent research producing conflicting results, rather than establishing that GLP-1 drugs themselves cause osteoporosis. There's also a major catch. What happens when you stop? In one major semaglutide trial involving people who were overweight or obese, participants regained about 2/3 of the weight they'd lost within a year of stopping treatment. That suggests that for people using these drugs to treat obesity, maintaining the benefits may require long-term treatment. But what does that mean for a healthy person who started taking them simply because they wanted to be thinner? Potentially years of medication, years of side effects, and possibly weight regain when they stop. Meanwhile, pharmaceutical companies are racing to develop more GLP-1 drugs, combination therapies, and even lower dose options as demand continues to grow. So the question isn't whether these drugs work. For diabetes and obesity, the evidence shows they can be powerful and potentially life-changing medicines. The bigger question is what happens when a medical treatment for serious chronic disease becomes a lifestyle product for people who may never have medically needed it. Because losing weight quickly is one thing, knowing what unnecessary long-term treatment could cost your health is another.